Well, and thank you, Zeke. That was an absolutely brilliant session. I loved it. I was screaming at the camera at times. Fortunately, I was still on mute, so you didn't hear me. But it was certainly many issues that I think will be debated for a long time over the next few weeks and months to come. I'm now going to moderate this last session of the day, indeed the last session of the conference, covering business and economic issues. Obviously a crucial piece of the jigsaw of influences on policy making. I should introduce myself. I'm Mark Pearson. I work at the Organization for Economic Cooperation and Development in Paris, an international organization grouping most of the richer countries in the world. And indeed, over the first 6 months of this year, I was leading an initiative at the OECD, trying to come up with some agreements on a blueprint for how digital certification might be used to open up borders during the COVID pandemic. Now, obviously, the reason why we're discussing business and economic issues is that travel restrictions have devastated both the travel industry and tourism industry and had knock-on effects throughout the economy. And this has not been a side effect of policy, of course. It's been the objective has been to stop travel and to restrict tourism enormously. But the cost in terms of dollars and euros, but also in terms of people losing their livelihoods and abilities to support their families, has been enormous. So what we'll just talk about in this session, we have 3 speakers to start, and then I'm going to ask the panel any questions that you might be raising. So you can, as you know, and by now, if those of you who have been at this conference throughout, you can submit questions using the chat function whilst the speakers are speaking, of course, right throughout their presentations. So let's get started. Our first speaker is a colleague of mine, Dave Turner, and David is the head of the macroeconomic analysis division at the Organization for Economic Cooperation and Development, where he does things like making the long-term projections for the global economy. And more recently, he's been part of a team which has been modeling the effects of lockdown and public health policies on both the spread of COVID-19 and on economic activity using a multi-country panel estimation approach. Well worth reading, really is. But let's get started then. Dave, what's been the impact of travel restrictions on the global economy?
Thank you, Mark. So, I mean, to start, a lot of our work at the OECD is trying to draw lessons and policy implications from comparing different country experiences. So I thought I'd just try and make 3 points, drawing on different international experiences. So my 3 points correspond to 3 slides. So Claire, if you could put up the first slide. Okay, I could have started out with some really spectacular slides looking at individual aspects of travel and tourism, looking at international passenger miles, falling off a cliff last year with dramatic falls, some recovery this year, but well below any sort of normality. Well, instead of showing those sorts of sensational charts, this is a chart that is trying to make the point that the impact on travel and tourism has the first order macroeconomic implications.
Dave, sorry to interrupt.
And that does that by showing that those
we're struggling a bit with bandwidth. Do you want to switch off your video and see if that helps a bit? Okay.
Does that help? Okay.
Let's see.
So this scatter plot is showing you the countries where travel and tourism is most important are those which have suffered the biggest hits to economic growth. And this is a simple scatter plot. I mean, it shows you countries like Greece and Portugal and Iceland have suffered the biggest hits. But if you have a more sophisticated relationship that controls for COVID infections, COVID deaths, the stringency of lockdown measures, this relationship is still robust and it actually gets stronger. So let's move on to my second point. And the second point is, I think it was mentioned in the previous session, the Delta variant really is a game changer. So this was a graphic we devised to try and represent some of the results we made from the multi-country analysis that Mark was referring to. We looked at the effect of measures to reduce the R number, and we found both that lockdown measures and vaccinations had big effects on reducing the R number. And what the graphic here is showing you is the equivalence between certain lockdown measures and getting people vaccinated. So the idea was that the more people you got vaccinated, the more easily you could relax lockdown measures and the benefit that would have to the economy. So for example, complete school closure would have the same effect on reducing the R number as vaccinating 8% of the population. And so that was the basic graphic. But actually what I want to draw your attention to is an update of that work. So that work was done on data estimated to mid-May. We've done an estimation updating that work in the last week. And what really comes out and what is new in this update is the massive effect that the Delta variant is having on the R number. So if Delta variant was going to become dominant in a particular country, it would have a massive effect on increasing the R number, which would have a bigger effect than the opposite side of vaccinating more than 30% of the population. Now, whether you believe that exact number, I think it's very, very clear that the Delta variant and the preponderance of the Delta variant does change things massively. It does require more urgency in vaccination. So my final point, third slide. So of course, having my final point is that having vaccination certification can become a way of overcoming hesitancy, vaccine hesitancy. And I wanted to give the example here of France. So the chart is showing you the percentage of different age groups in France that have been vaccinated, have had at least one vaccination. So you can see the older age groups, there's quite high levels of vaccination, getting over 80%, but much lower levels of vaccination for the younger age groups. And France is a country which right from the start has been one where there's been much greater reluctance to have vaccination. But actually the point of the slide is the break before and after the red dashed line. So the red dashed line is marking in mid-July, President Macron made a speech in which he announced, well, firstly, compulsory vaccination for a lot of health workers, but also that you would require a health pass in future to eat at restaurants, go to cinemas, use trains, and that health pass either required vaccination or proof of a negative test. And the point of the chart is to look at how those younger age group lines kink before and after that announcement. So the rate of vaccination after, in the second half of July, was about 30% higher in these younger age groups than before the announcement. So I think it does illustrate the potential that having vaccine certification and using it as an obligation can have on raising vaccination rates. I should also add that there is some opposition, and there have been street marches. So there has been some opposition. Some people say reminiscent of the sort of earlier marches of the yellow vests, but it has had a big effect on vaccination. So there are my 3 points. I'm going to take a deep breath and try and summarize them all in one go. And that's this: if vaccine certification could be used to get travel and tourism going, it would have a first-order macroeconomic effect on a lot of countries, including improving the prospects of a lot of countries that have been hardest hit. It could also be used to overcome some degree of vaccine hesitancy, and France gives you that example. And then finally, I would add, and maybe I should have started out by saying this is not the OECD speaking, but my personal opinion is the Delta variant does really add to the urgency, and I think makes a stronger case for using vaccine certification in that way. Okay, thank you very much.
Thanks very much, Dave. And I should maybe just add to your point about the demonstrations in France. I'm currently on holiday in the south of France, which I'm telling you all not to make you jealous, although feel free to feel jealous. It's lovely here. But actually, about 2 hours ago, there was a big demonstration against these vaccine certification being required for restaurants. In fact, the main people protesting were the restaurant owners because they'll have to spend about €4,500 on the equipment and the necessary documentation to actually get these certificates working. If you're going to actually check everybody who's going into the restaurants that they've been vaccinated or indeed don't have tested negative against COVID. Dave, before I let you go, I do want to just push you a little bit about this issue about travel restrictions more generally. Is it the case that the economic impact is greatest for the country that imposes the travel restrictions? Or is it actually just more generally that there's an impact more widely from the lack of international travel due to the travel restrictions?
Yeah, that's interesting, because we do have a lot of detail of restrictions for individual countries. When we try to add that to the analysis, it's actually quite difficult to get that to work. And I think what matters more is sort of restrictions for the general region. And I think that, one interpretation of that is the restrictions matter not just for the destination country, but for the origin country as well. And I think that speaks to broader issues of the importance of coordination across countries and consistency of rules and mutual recognition of things like vaccine certificates and testing, which of course have been discussed here and at the OECD and at the